So the next speaker is Dr. Puneet Rai from the Oregon Health and Science University, who will talk about the natural history of BPAN and BPANready.
Okay, thank you. Can everybody see my screen?
Yes, we can. Dr. Arcangela, could you just turn your video off, please?
Okay, so I will go ahead and get started. So my name is Puneet Rai, and I'm a genetic counselor at OHSU, and I've worked with Dr. Hayflick and Dr. Hogarth and Allison for about 6 years now. And one of the projects that I work on is our natural history studies. And so today I'm going to talk about the BPAN natural history study called BPANready and how we designed and built that study and where we're at right now. And so the goals of this study are, pretty common goals for most natural history studies. The first is to better understand the full spectrum of BPAN. And this is really important because our initial studies and papers on BPAN were focused more on older individuals with BPAN. And so now that kids are getting diagnosed at younger and younger ages due to the increased use of exome and the WDR45 gene being on more and more seizure panels, it's important that we really get the full spectrum of this condition. And next is to hopefully identify some disease markers that could be used in future clinical trials. And a disease marker could be something like a symptom or a measurement or a biomarker that happens reliably in a condition and could be used to measure if a possible treatment is working. And so when we were designing this study, we used a few different pieces of evidence to develop our questions. The first was what we currently know about BPAN. And one of the most important things is the difference in symptoms that occur in children who are younger versus adults with BPAN. So we really wanted to make sure that the questions we designed were specific to different age groups. And next is anecdotal evidence. This is based on clinical appointments we've had with BPAN patients and the types of questions they ask us and our exams of patients. One thing that came out of this was that we started noticing that we were getting a lot of questions about possible signs of precocious puberty in a lot of patients with BPAN. So we wanted to make sure that we looked at this further in the natural history study. And then finally, parent feedback. So we had a BPAN meeting in Portland a few years ago. And as a part of that study, what we did was have breakout sessions with parents to ask them what symptoms are the ones that you're most concerned about and what symptoms have had the biggest impact on your life. And what parents told us was seizure management, behavioral challenges, and sleep problems were the biggest things that were important to them. So we used all of that together and came up with 5 focus points of the natural history study, which include seizures, motor impairment, language, communication impairment, autistic behaviors, and sleep disorders. And so we started building BPANready by first picking a platform. We used REDCap, which is one we've used in the past for our PCAN and PLAN natural history studies. So it's something we're familiar with. We know the limitations and some of the benefits of the platform. So we decided to use that again. And we wrote questions based on the key points that I mentioned before. And we developed disease-specific milestone questions as well as developmental milestone questions. Most of these are prospective, but a few of them are retrospective because we wanted to try to capture some of the early developmental milestones. And next, we incorporated validated tools to add power to the data we were collecting. Some of these include the Vineland Adaptive Behavior Scale, the Infant Toddler Quality of Life Questionnaire, the PROMs, which are patient-reported outcomes that look at physical, mental, and social health, and then a repetitive behavior scale. And once we had all of the questions that we wrote and the questionnaires that have been validated, the next piece that we had to figure out was, how do we present all of this to families? So one thing that was really important to us and that we've learned by doing natural history studies is to try to personalize the experience as much as possible. And that was something that came about as we were doing these studies. We realized it can be frustrating and sometimes distressing for families when they have to answer the same question over and over again about either symptoms that their child is having or milestones that their child isn't hitting or skills they've lost. And so what we tried to do as part of this study is to really personalize the questions to where each child is at developmentally. And the way we've done this is, as part of the study, some of the questions are asked over the phone by our study coordinators, and they're able to adjust the questions they ask based on the responses that they're getting from the family. And the next thing we incorporated based on what we've learned from previous natural history studies is when to utilize manual surveys and when to utilize more automated systems. And what we decided to do, I'll show you a little bit later in the workflow. So this flow of events shows how participants move through the natural history study. The link is on our website. Families on the welcome page, they see all the different components that are involved in the natural history study. Some of the requirements, like, for example, being able to speak fluent English. That is very important for some parts of the study, and I'll touch on that again a little bit later. And so once they have all that information, we tell them, to make sure that they have the records that they might need to answer these questions ready when they start. And they go into the survey. They go into the study by first going through the consent forms, and they can sign the consent forms online or contact us if they have more questions. They give us some basic demographics information, and then they move straight into the questions. And at any point in this, after the demographics, they can pause and save the survey and come back and do it later if they realize it's taking more time than they planned, or there's some records they need to go get to answer some of the questions. And once they've completed the medical history questions, the milestones, and some of the validated tool questions, they have a call with one of our study coordinators where they either ask questions about anything that they were unsure about in the survey, or that our study coordinators realized maybe didn't get answered exactly the way we were hoping. And also our coordinators then figure out how to request medical records, so we can use those to confirm some of the milestones and disease questions that we're asking. And at that point, they're done with visit 1. And then 6 months later, they come back for visit 2. And in visit 2, the way we've set it up is the disease milestone questions and the developmental milestone questions our coordinators do over the phone. And then participants get links to complete the other questions online. And at that visit 2, we also work with families to obtain a blood sample. And we are collecting these to hopefully figure out a possible biomarker for BPAN. So here are some screenshots of the study and what it looks like. The first is just the welcome page and has some of the requirements that they need to participate. And here's an example of some of the disease milestone questions. We do have it set up so there's a lot of branching. So depending on what questions they answer yes or no to, certain questions appear or disappear. And here's an example of a page where if they decide to save and they want to come back to it later, this is what they get. And they get a return code that they can enter when they come back. And it takes them straight back to where they left off. And the other thing we wanted to make sure was to try to limit the burden on families as much as possible. Those of you who work with children know how long the Vineland and the ITQOL can be. So what we came up with was a way to alternate which questions they get asked. So at visit 1, at every visit, they get asked the milestone, the disease milestones and the developmental milestone questions. But then at visit 1, they do the Vineland and some of the promise questions. And then at visit 2, they do the ITQOL and the repetitive behavior scale. And then at visit 3, they go back to the Vineland and the prompts, and it alternates back and forth. And since each visit is 6 months apart, we do get the full data set at least once a year. And one of our early concerns for incorporating phone calls as part of this was what kind of impact that would have on the amount of work for our study coordinators, and would that impact be worth the effort they were putting in. And our coordinators have told us that it is absolutely worth it. And they've really seen a vast improvement in engagement and retention in this study compared to our previous natural history studies. And they feel that families being able to engage with us on a personal level and be able to talk about where their child is at and what they're going through has really helped keep them in the study, and has helped make the process, again, more personalized. And we recruited for this study through our NBIA Center of Excellence in Portland, where patients travel to see us for visits, through our NBIA Cure website, newsletter, and our social media pages. And the NBIA Disorders Association also helped with advertising. And we also inform any clinicians who consult us about BPAN cases about this study so they can share that with their patients. And here is where we're at in the study so far. So we've enrolled 113 total participants, and these numbers are up to date as of Friday. And so far, we've only had one participant drop out, and that was because their child was declining, and having to answer questions about that decline was very distressing to them, so they decided to drop out. And so we have 112 participants who are currently active in the study. And on the right side, you can see the male-female ratio, which is not a surprise considering BPAN is an X-linked condition. And this graph shows the age breakdown of the participants. On the left, you can see, on the Y scale, you can see the ages of the participants, and on the X is the ID numbers. And so the first 20 participants who enrolled tended to be younger. And then we did more of a focused outreach on older participants. And so we were able to enroll some older participants, and we've been able to keep that steady as we go on through the study. But overall, you can see that the vast majority of our participants are younger kids, and some, close to a year age or even younger. And so this shows that we've done a pretty good job of getting a good distribution of ages, even though there is more of a focus on younger participants, which again is due to exome and seizure panels being used more frequently and kids getting diagnosed at younger ages. And here is the breakdown of ethnicity. The vast majority of our participants are white or Caucasian, but we do have a few who are American Indian, Alaskan Native, Black, Asian, or more than one race. And about 7% are Hispanic. And here is a map showing all the different countries our participants are from. The vast majority of them are from the US, so about 70%, but we also do have quite a few from Canada, the UK, and Australia. And even among the other countries, you can see these are countries where English is one of the more common languages that are spoken, because that is one of the requirements of the study. We do have participants who, I wanted to point out that one of the challenges we've had with participants who are in other countries, we tried to incorporate them as much as possible, but sometimes one of the limitations is that their medical records are not in English, and that can be a barrier because we do use those to confirm some milestones. But we do try to accommodate participants from other countries as much as possible, and we've even coordinated blood draws in other countries to capture as part of this natural history study. And then even within the US, we have a pretty good distribution of participants from many different states. All the regions of the United States are well represented, except Alaska and Hawaii. And here's where our participants are at in the study. So about 21% of them have completed one visit so far. 11% have completed 2 visits, 21% have done 3 visits, 18% have done 4 visits, and 29% have done 5 visits. And those are the participants who are furthest along in the study. So we're 2.5 years into the study. One of the things that was really great breaking it down by this way is that we were able to see that our enrollment has stayed pretty steady. So we have a pretty similar number of patients who are at various stages in the study, and so that is very encouraging. And next is just a breakdown of the types of samples that we've collected so far as part of this natural history study. We've got 82 blood samples, 52 of which were obtained exclusively through BPANready. We've got 10 urine samples and 31 fibroblast cell lines. So in terms of data analysis, what we've done so far is a preliminary feasibility study just to make sure we were on the right track. And this was through our partner, Dr. French at Washington State University, and his team used a latent growth curve modeling approach and determined that our approach was feasible, and that the data that we're collecting is at a good place to be used for power calculations in a clinical trial setting. And we do have a full data analysis planned once we're further along in the study. Okay.
Thank you, Puneet.